Hey everybody, it's McKenna, and today we're talking about healthcare providers and washing our hands. So it is really important for us as healthcare providers to make sure we are maintaining proper hand hygiene and washing our hands in between seeing patients and coming into contact with their areas or environments, because they have a lot of diseases and germs and bacteria that we may not know that they have. And if we're not properly washing our hands, we could be passing that on to other patients that we see, or taking them home to our families and then sharing that with them. So proper hand hygiene is so important in healthcare. And today I'm going to show you how I do it. And I'm also going to tell you what I do when I can't wash my hands immediately. So we're going to start with making the water as warm as possible. And sorry, this is so hard for you to see, but we're going to wash our hands now. So you check the temperature of the water, and the warmer the better, because warmer water will kill more germs. So I like to get mine as hot as I can stand. And then I just like to make sure my hands are good and wet, so then the soap lathers a lot better. And then you take a couple pumps of soap and you just make some suds. You get it all bubbly and good. And I like to wash my wrists, because sometimes my gloves don't always cover my wrists very well. And I will also take off my watch after calls and clean it with a disinfectant wipe, just to make sure I'm getting all of the nasty stuff off of there. So your hands should be very bubbly, sudsy, wonderful. And you're just gonna scrub fronts, backs, nails, wrists, whatever needs to be scrubbed. And you can do this for about 20 to 30 seconds is recommended. And then you're going to rinse that off. Make sure you get all the suds off. Get under your fingernails. And then I just like to shake off the excess water. And then you're gonna dry with some paper towels. I am not approved with paper towels. I like to make sure that my hands get dry. So use as many paper towels as you want, unless you don't want to use that many. It's up to you. So make sure your hands are dry. And that's it. Just remember to wash your hands after every patient contact. And for me, at my job, if I'm not somewhere where I can readily wash my hands immediately, we have a jar of hand sanitizer that we keep in our truck. And I will use that in between calls to make sure that my hands are somewhat clean for the next patient. And then as soon as I get back to the station, I'm immediately washing my hands. So thanks, hope you enjoy. Have a great day.